all those things. The biggest group of dementia that we talk about is, obviously, all of you may have heard, it is Alzheimer's dementia. That constitute around, I would say, 50 to 60% of the dementia. And then there is another big group called vascular dementia. Vascular dementia is related to poor blood supply to the different parts of the brain that leads to dementia. And then smaller groups are, another group is called frontotemporal dementia, Lewy body dementia, Parkinson's associated dementia. So there is multiple types of it, but the biggest one is Alzheimer's dementia. And another part is that there is a lot of people who have mixed dementia also, like people, like person with Alzheimer's dementia can also have vascular dementia. And there is actually overlap in the pathology also, like people who have vascular dementia have a higher risk for having Alzheimer's dementia. So but globally speaking, it is a brain disorder that affects the memory, language, and it kind of progress over time based on our experience so far. Yeah.
Thank you, Dr. Gireesh sir. So moving to our next question. So what are the early warning signs of dementia, and like why is early detection as important?
The warning signs will include like difficulty with memory, getting confused, losing track of time. You may start forgetting things where you kept something, or like if people are driving, they may lose their way. So those are usually the early warning signs. And then depending on the type, some people will have also language problems or abnormal movements. So it depends what type of dementia is. There is importance in detecting it early, partly because, once you, like, even after you start having some level of cognitive impairment. So we call it minimal cognitive impairment or mild cognitive impairment. You still can take steps to minimize the progression, depending on the type of dementia. And secondly, it is also important for the caregivers, the family, and everyone to plan what to expect. There is some new treatments are also coming in horizon. It is still not groundbreaking to the point that it will abort the progression of the disease. That stage has not come yet, but in the near future, hopefully we will have some treatments also. So from all those standpoints, it's important to get a good understanding of if we are developing dementia and how to minimize the risk of that progression.
Yeah. So building on that point, so I would like to delve into, like, can you explain the link between lifestyle choices such as diet and exercise and dementia risk?
Yeah, so that's where we have to go a lot. Okay, so that is probably the focus of my talk mainly. That is where we will focus mostly. So there is multiple areas that somebody can address to minimize the risk of dementia. These are lifestyle choices that we make over time. So some of the recent studies classify it into risk factors early in life, risk factors later in life, or like midlife and later in life. So what we have found is there is an association with poor education and risk of dementia. So like those who are have a lower level of education have a higher risk of having dementia in later life. So that means it's important to have good education. So the risk for dementia starts in childhood itself, to put it in the other way. And then we go to midlife. So that is the time when we have a lot of potential to intervene. All of us, like people between around 45 to 65 years. So that's the time there is a lot of potential to intervene. One of the major risk factors we have identified, or like the studies have identified, is obesity. So especially those have high body mass index. The body mass index is a measure of how much obesity a person has. So if they have a body mass index of about 30, they definitely have a much higher risk of developing dementia in later life. Another major important factor is traumatic brain injury. So yeah, studies have shown that even mild traumatic brain injury, like you get hit your head somewhere, fall somewhere, and like lose consciousness. So those people also have a higher risk of having dementia. So that is one of the risk factors that we need to address. Another one is hearing related. We are increasingly recognizing that people who have hearing problems early in life, they have a higher risk of having dementia. And the important aspect is the studies show that if we address this hearing impairment early on with hearing aids, cochlear implants, all those things, that risk is actually reducing. So it's important to understand that. Then the other very important lifestyle factor is alcoholism. So increased alcoholism is associated with very high risk of dementia. So people who stop using alcohol actually tend to reduce their overall risk of progressing into dementia over time. Another risk factor, then we have all the cardiovascular risk factors. I mean, all these play into that, but if we identify specific cardiovascular risk factors, high blood pressure, that is a major risk for having dementia. It's a risk factor for everything, right? Like not only dementia, stroke, like other general disorders like kidney disorders, heart disorders and all, but specifically in the world of dementia, hypertension is associated with a high risk of progression into dementia. And that kind of, we can add other factors, including diabetes, high cholesterol levels, and all to that group, which all put somebody at higher risk. So these are the things that better to address in early life between 45 to 65 years, partly because the studies show that people who develop hypertension early, means high blood pressure early, have a much higher risk of having dementia than somebody who develop hypertension much later in their life. Like if they develop it in 70s, 80s, they don't have as much risk of having dementia-related hypertension. So, so that is a very important risk factor. Actually, the studies show that the blood pressure medicines are the only medicines that are we can accept as preventing progression to dementia. So it's very important that we address the high blood pressure. And the WHO or the different agencies recommend a systolic blood pressure less than 130. So I mean, we have to. Everybody may want to discuss it with their doctor. What is their ideal blood pressure? But so it's important to address those risks. So I mean, those are the mid-age risk. Then after 65 years, I think this some of those are not segregatable to individual group. Like all these can have some overlap. Another big risk factor is smoking. So reducing smoking is associated with much less likelihood of having dementia. Then the more towards the later life, the risk factors are like depression. People who develop depression in a later life, like after 65 years, they are known to have a higher risk of having dementia. Like depression, it may lead to their social isolation. They are less likely to be active. I think it acts in multiple ways, not only from direct depression standpoint, but it also affects their cardiovascular health also. Few other like purely lifestyle. I mean, like when we talk about lifestyle, physical inactivity or activity. So like being active physically, like doing exercise, like especially aerobics, as well as some weight-bearing exercise, is known to be associated with minimizing the risk of dementia. And that is actually some of the studies show that even among people who have developed dementia, if they are physically active, that reduces the chance of further progression of the dementia, or at least it slows down the progression over time. Another risk factor that has come into picture more recently is air pollution. So we are increasingly recognizing that poor air quality has a big impact on potential to develop dementia among elderly population. So it is important to address that also. That goes into our general question of pollution, our having good neighborhoods, like having good air quality and all. So it's important to recognize that the maintaining a good environment plays into maintaining good cognitive health over time.
So thank you, Dr. Gireesh, for sharing the insights on the link between lifestyle choices and dementia risk. So now turning our attention to a different aspect. So you mentioned about the exercises. So I wanted to ask, are there specific cognitive exercises or brain training activities that can help preventing dementia?
Actually not. Like the direct answer is no. There is no particular one exercise that will prevent dementia. But staying cognitively active in whichever way one prefers is a way to minimize the risk of dementia and minimize the progression. So that is not. It is probably better to not take it as an exercise, like staying active with your hobbies. Like if you are socially active, staying active, actively connected with your friends, family members. Do whatever you like. That has an impact in minimizing the progression. Like if you are asking about something like cognitive exercise, like puzzles, crossword puzzles, or Sudoku, those kind of things, they may help as long as those individuals are enjoying it, doing it. So that may be a good strategy to keep cognitively active. So the short answer is staying cognitively active will benefit, but there is no one solution that everybody should follow.
Yeah. So thank you, Dr. Gireesh, for sharing the insight. So viewers, before moving further, let me tell you that eGlobal Doctor is one complete healthcare platform solutions for all your medical related issues and questions. And मजे की बात यह है that you have these services available to you at your fingertips without brain kicking or bad manners, and without driving all in the comfort of the living. So, Dr. Gireesh, like we have covered a lot regarding the topic. So, could you share some tips on creating a dementia friendly environment at home or in a care facility?
Mm. Yeah, that's always a challenge. Okay, how to care for dementia patients. This is becoming an increasingly important and challenging area. As I mentioned, the care of dementia, it has a huge economic impact itself. So, so the most important aspect I would say is that patients, like dementia patients, are more like children. Okay, so they need care, and you may need a lot of patience, like whoever is taking care of. So it's as the incidence or the prevalence of dementia patients is increasing, more and more patients are being cared by at home by their family members. So there is huge challenge. So there is a lot of need for education for the caregivers. So one important aspect I want to stress is patience. So like it will take a lot of time for understanding what this disease is, and they can have behavioral issues. They will not, the dementia patients will not behave the same way as they used to behave previously. So that's always a challenge. So, for example, they may take at least 2 or 3 times time to have their food. Like they will, it may take more time for them to eat itself. So that is one very important aspect. There is multiple aspects. And second thing is try to get as much resources as possible. There is a lot of online resources. I share with you some of those links at the end, or we can put it in our the website that people can go into and get an idea. There are, apart from the cognitive issues, the dementia patients also will suffer from a lot of neurocognitive, like neuropsychological challenges. For example, depression, anxiety, panic attacks, rage. So they all go through different stages of this over time. It's not that they will have all of this at any time. Actually, dementia is a progressive active disease. So depending on which particular area of the brain is activated or actively involved at that particular time, these patients will have different symptoms. So at some stage, they will have more defensive character, aggression, rage, and all. But over time, they will become more dependent. At some point, they will have depression, anxiety. All those are important aspects. One important aspect, especially from a legal standpoint, is you may want to get approval for getting their medical records or getting medications. So that may be important to get it in the early stages, so that at later stage, when they end up in the hospital and all, you don't have to face that question when these individuals are already not having capacity to make decisions for on their behalf. So it's important to address those things. So it's not one thing. Everybody will need tailor-made solutions. So like every individual with dementia will have different needs. But I'll go back to the initial word that I use, patience. Every caregiver will need a lot of patience to address this.
So thank you, Dr. Gireesh, for sharing the tips on creating dementia-friendly environment. So Dr. Gireesh, moving forward, so are there any dietary supplements or foods known to support brain health and reduce dementia risk?
Again, the short answer is no, unfortunately. The part of the reason I want to emphasize that no is there's a lot of misinformation going on about, oh, you take this supplement that will reduce the risk of everything. But yes, there is some role for diet. Okay, it's not that you don't need to pay attention to that. So the diet that is good for your heart is also good for your brain. So that's the way the thought is going on now. So if you ask one particular diet that is given a lot of importance by like WHO and all, it's like Mediterranean diet. Again, Mediterranean diet does not mean that everybody needs to go to Mediterranean, but so the emphasis on the Mediterranean diet is mainly plant-based food, predominantly plant fruits. They use olive oil, but like depending on different regions, you can use that or some other oil which is appropriate, and then minimizing. I mean, they give importance to fish, which contain polyunsaturated fatty acids, omega fatty acids, and all. Then minimize that supports cardiovascular heart health is also thought to be helping with minimizing the risk of having dementia.
So thank you, Dr. Gireesh, for providing lots of information about the topic. I think our audience has got lots of useful information about the dementia prevention. So Dr. Gireesh, can you provide a summary on some practical take-home message for prevention of dementia to those audience who just has joined?
So let me share my one of the couple of slides just to highlight the point.
Yes.
So I hope it shares. Can you see the screen?
Yeah.
That I shared. So these are the important aspects that I want to share once again to re-emphasize how important these aspects are. One is exercise. Generally for cardiovascular health, it is important. So stay active physically. You can do aerobics, you can do some weight-bearing exercise. This has a big impact in minimizing pretty much all disease, but actually dementia also. Addressing hearing issues is important, and try to address it as early as possible. When somebody is developing those, it is important to pay attention to that. As I mentioned, early education is known to help with minimizing the risk of dementia. Reducing the smoking or like stopping smoking, that's important to minimize the risk. As I mentioned, the heart health in general, like avoiding high blood pressure, and I can't emphasize this enough, because it's not only just dementia that you're preventing by avoiding hypertension, like multiple other factors, multiple other disorders, but high cholesterol levels, all those things are also important. And another one is nutrition. To minimize the risk of dementia, as we mentioned, we need to address our nutrition appropriately, making sure that you eat healthy. The general word we mentioned is Mediterranean diet, essentially more plant-based. and fruits, vegetables, and all. But maybe minimizing the use of red meat will also help. Another aspect maybe we did not cover as much earlier is sleep. Sleep is there is a lot of studies indicating there is strong association between sleep and dementia. So it's important to make sure that you sleep well, and that's a major concern for a lot of people. Some people don't get healthy sleep because they have sleep apnea. It's like snoring, and snoring causes lack of adequate oxygen going into brain and all. And second group is they don't get enough sleep. They are not able to sleep. So there are multiple strategies to address it. I know that you guys have done a session on that itself. So, but that's an important thing. Another aspect we mentioned is mental health. Depression is known to have a strong association with dementia. Social activity, maybe staying active and staying active in social circles, friends, family. This is known to have a good benefit in terms of minimizing the risk of having dementia. Intellectual activity. So staying active with whichever activity you like. That is what I would say. It does not have to be anything in particular. It can be crossword puzzles or Sudoku, but it can be like even volunteering somewhere. So those kind of activity would help. Another aspect is head injury prevention. To minimize the risk of dementia, we should pay attention to that. Like it's not always in our hands. Nobody deliberately get involved in head injury situations, but it's important to take that into account. Apart from that, I also want to put these ideas in a perspective of how it affects in different stages of life. This is partly because that is how we can address it more appropriately. So education in early stages of life, in midlife, that is like between 45 to 65 years, address the risk factors like hearing loss, head injury, high blood pressure, alcohol, obesity. The smoking kind of will go to both these stages. And in later life, other issues that needs to be addressed is like smoking, depression, social isolation, physical inactivity, air pollution. That's another important thing that has come into picture now, and diabetes. All this, the point is the approximately 40% of potential dementia can be at least minimized. That risk can be minimized by addressing these risk factors. I'll stop sharing my slide here.
So thank you, Dr. Gireesh, for sharing useful information for prevention of dementia. So viewers, if you have any signs or symptoms of dementia, there is no need to worry because our experts at eGlobal Doctors are here to help you at the comfort of your home. So you can visit the website eglobalDoctors.com or download our application now. So thank you so much, Dr. Gireesh. It's always a pleasure to have you on our live sessions. You always bring so much of information.
Thank you. Thank you for having me. And I hope it has helped the people in addressing this question. And it's very important to minimize the risk. I can't stress it enough. Okay, thank you.
So audience, before wrapping up the session, viewers, are you looking for an expert second medical opinion for cancer treatment? Well, look no further because eGlobal Doctors is providing access to top oncologists from across the world. So thank you, doctor. Thank you, audience. So it's a wrap.